Good afternoon, everybody. Thank you so much for joining this live stream. I am reporter Miranda Christian. I am joined by Dr. Gopalan. Now, Doctor, will you introduce yourself a little bit, talk about your specialty?
Hi, I'm Dr. Gopalan Ramprasad. I'm an infectious disease consultant who practice in Palm Beach County.
And you are joining us here today to talk about COVID, specifically about this new variant and some other news that has come out recently about people who are vaccinated. And of course, anybody who has any questions, please leave it in the comments. We'll try to catch it and ask those questions. Now, we'll just kind of get started here with looking at some of the numbers. If you look at the number of people who have been vaccinated, in the country, I know the CDC says over 150 million people have been vaccinated. Here in Palm Beach County, we have over 800,000 people. Where do you think we are right now in terms of the overall pandemic?
Well, in terms of overall pandemic, had this Delta variant not been in the picture, probably we would have progressed a little better. Okay. Having said that, we still have ways to go. Vaccination does prevent disease. It is proven time and time again during the course of entire vaccination. So we still have ways to go. Well, there is vaccine hesitancy or people have issues, whether they are fact poor, they need to get their facts, at least checked. So, okay, now you decided for yourself that you're not getting vaccinated, then at least you got to protect yourself when you're out there. So where we are at this point, we are not in a full comfort zone yet, but we are heading towards there.
And this Delta variant that's come out, we know more cases are being confirmed with this variant, that the US now, I want to say 20%, that was the last number I saw. What is this Delta variant and where is the concern with it?
Okay. Now, if you take April and before, it was 0.18, very minuscule portion of the virus was this Delta variant. It originated in India, of course, it was there since October of 2020, but that caused that huge wave of disease in India. And then it is in almost 80 countries plus now as it originated. Virus is smart. Now it is here. Now it's from minuscule portion in April to now of 20%. We have to be concerned. Now, I have seen personally a lot of patients, we see the numbers rising. Now the patients who are coming in are, 20 to 50 range. And then I ask one question to each and every one of them. Are you vaccinated? Invariably, the answer is no. So the Delta variant transmissibility is high. That means, it transmits with ease. So we have to be concerned about it because as more and more people are getting vaccinated, now if you stop at just below the comfort zone, now we have to worry about this variant a lot more than had the population been vaccinated fully. To mitigate that, people are now becoming complacent in wearing their masks. These are the people who are not vaccinated. Vaccinated people who are fully vaccinated people, let me clarify that. Fully vaccinated people who are, out there without a mask, it's, still maybe okay, but, still that's what, we have given consent for that. But now people who are not vaccinated, how can you? I mean, you're at full risk. Would you say, for example, this is not a disease that comes like this. You have 14 days to 28 days of incubation. So, for example, a person who is got in contact with the disease now goes to, say, a big theme park. Now you have 100 people, another 100 goes to the next 100. Just imagine yourself. In the last 14 days, how many people have you come in close contact with? Imagine that many people, each and every one of them for 14 days, how many people they can contact. This is how the pandemic propagates. So everyone has a role to quell this and have a normal life. So yes.
And you hit on it some here, and I see a lot of questions coming up in the comments too, that this Delta variant, still a lot of unknowns, but has there been any evidence so far that those who are vaccinated should have any concern about this variant?
Okay. Now, the good news about that is there are both the vaccinations, what we use in the country, Moderna as well as Pfizer BioNTech. The Pfizer BioNTech has good protection, maybe very minuscule lower, than the original variant, but still it offers enormous protection. Recently, we just had Moderna also released the data which says it protects against Delta variant. Now you see, as with any vaccination, there is no 100% with anything. So your chance of being hospitalized, getting severely sick, is negligible, is very, very low, even if it affords the protection. So yes, it does protect, and you should get vaccinated.
That's a good question. I had to kind of follow up. We hear the breakthrough cases is what I know the CDC is referring to them as, is if you get COVID after being fully vaccinated. And I know their first round of reports that came out to the end of April, they said it was very rare to become infected after being vaccinated. Their last round that just came out, the numbers were still relatively low in their terms. Right now, if you look at the breakthrough cases, what is your interpretation of those numbers and how someone is vaccinated? And as you said, getting COVID again, what are you seeing in those cases?
Okay, as with any vaccination, your body has to respond to the vaccine or whatever the immunogen we inject. It's just not with COVID. There are a lot of vaccines. There are some population who do not respond at all because of their immune built up immune system, how their immune system react to the vaccine.
Yeah.
And there are certain cancers and certain other conditions where their immunity is so low they don't make the necessary antibodies to protect. So there is a select population, whether it is COVID or any other vaccine, they don't respond. So there is that. And there are certain people whose response is lower. Barring that, majority of the population, for as far as we're concerned, it is an effective vaccine. It has to be. You have to. Have you been fully vaccinated? Yes, I am. So that's where we are at. It is fully effective, even with the new variant.
A new study just came out that said, and let me look through my notes here, going through the vaccine studies, that it was great news for those who were vaccinated because it was promising with a certain type of B. Let me get my exact notes here so I'm not saying something. It was the certain type of B cells found in the lymph nodes were lasting up to 12 weeks. And that it's very promising that these vaccines could last up to years. When we look at this and look at, this is all new to all of us, is that very promising news? And as these studies come out, I guess, how promising is this news?
Well, any vaccine, they have two components. One is called cell mediated. That means the cells, what we are talking about. And there is a humoral component. That means the actual antibody, which is made by the cell. But there are cells which keeps this in memory. And next time it deals with this virus or anything that it has been immunized against, it will make antibodies. There are memory cells, B cells, there are cell-mediated immunity. This is a normal course in majority of the diseases. So now the more cell-mediated immunity lasts longer. So next time when you're exposed to the same, like a virus or any of the immunogen, so your body makes antibodies to that. So you have right now the body responds with a good amount of antibodies, technically neutralizing antibodies. So now you're fully protected. So that's a good news. So right now it's in our hand to curtail this because this Delta variant is really concerning. There are certain states who are running out of bed. It correlates very well with the immunization rate in that particular locality. There is a state where actually they are transferring patients to different locality from their main hospitals to the peripheral hospital. That is reminiscent of where we were you know last year and in the mid part of the peak. Do we really want to go there? No,
Yeah.
we should not go there. And our vaccination rate should go up. The states where I mean, they have to confirm fully that where they are moving patients to peripheral hospitals, the vaccination rate is dismal in my view. So please do your part and get vaccinated so we can all be leading a normal life.
And curiosity here, I know back in kind of end of March, beginning of April, the CDC director came out and was very worried about this, I think a fourth wave or third wave of cases going into winter again as people started coming out. And then about a month later, all these restrictions were lifted. As we look at how we are in Florida right now, there are very little, if any, restrictions. How does that play into this? Have you seen that fourth wave, or is there any concern about those waves still, knowing the number of people vaccinated and as we keep moving forward with more people getting the vaccine?
That's a very appropriate question. Just look at other countries where this exact scenario happened. Just look at India. They had, beginning before that major wave happened, there are hospitals in major metropolitan cities declared there were no COVID patients. Before this, millions of people got infected. Just before that, everything was a lull. And there came, people stopped wearing their masks, restrictions were lifted, just exactly what we are doing right this minute. But we have one thing, going for us. Our vaccination rate are better than what happened out there. So we still have to go a long way, but we are a little better than, that pandemic, which just took another wave with the Delta variant, and they suffered enormous consequences and lot of life lost and a lot of productivity. The country went through a grinding halt. We really don't want to go there. We have all the resources which are given to us. There are places where they have no resources. They are begging for vaccines and they're standing in line trying to get that. This reminds us of how we were before. Now it is available in every drugstore in the corner, and they have free vaccine. Please come in at no cost. I mean, you can't be doing anything better than that. I mean, you have to get vaccinated. That's where the restrictions being lifted and us getting protected can go hand in hand to have a normal life. Us listing restrictions and we are not protecting and we are propagating the issue, we're gonna have definitely we may have a trouble. And seeing the little blip, and all these patients whom I see personally, who I'm seeing in the hospital now, are younger and they're not vaccinated. So we can prevent this. It's in our hands.
Yeah. And is there any sort of data or anything else that has come out recently that has stuck out to you, especially in the last couple months? I feel like a lot of these studies have come out. We have a lot more information about this pandemic. Is there anything else that's kind of stuck out to you that is either good news or maybe not so good news?
Well, the good news and the bad. Good news, let me go to the good news. Now, the study which Moderna did, which said it is effective against the new Delta variant and all the variants which it had tested. That's a great news. So is Pfizer BioNTech. We have vaccinated. Those two vaccines have been prevalent in our communities. We've used those two, exclusively. But there are countries where they've used, vector vaccines, which their efficacy was proven to be lower. And they're also seeing much more of the Delta variant, because their efficacy was lower against this particular virus. I mean, the death rate is still markedly lower than what would have expected without vaccination, even with the vector vaccine, So I think the good news is it does protect. The bad news is I just heard one of the state with the lowest, vaccination rate Their ERs are full, hospitals full. They are diverting patients to the peripheral hospital. I really don't want to hear that because it's deja vu and it does give you a bad taste, like we have been there, and we really don't want to visit that. So the only way we can prevent that is us by getting vaccinated, which is afforded to everybody who's, I mean, majority of the adults at least, including the children. So that's where we are. That's the good news and the bad news part.
Yeah. And on top of that, all these studies that are come out proving the vaccines could last longer than we originally thought, which can shed some extra good news on top of maybe a concerning variant.
Correct. I mean, it's an unknown. As people say, how do you know this? How do you know that? Listen, we are in an unknown. In the unknown, you got to start thinking risk benefit analysis. Yes, is it 100% safe? 100, nobody knows all that. But, with the millions of people who got this, what is the majority consensus? So majority consensus are they're all fine. Yes, you will have injection site reaction. There's minimal reactions been there. Okay, so they're the vaccinated population doing well. So that's pretty much the bottom line is, and they're protected.
Well, thank you, doctor, so much for meeting with us, going through all these topics that have come up. I know there's been a lot of fatigue around the conversation. It's something we've talked about endlessly, almost it feels like forever now, but we appreciate it so much. And going through some of this new information with us today, we appreciate it.
Hey, thank you. My only last parting word is the vaccination is still safe. Yes, there are pluses and minuses. And okay, so you decided vaccination is not for you. So what you gonna do? Okay, fine. You, for all the reasons you've decided, personal choice, fine. Please, when you go out, protect yourself. Wear a mask. And the risk, the virus didn't go anywhere. It's still here. Very much it is here. And it is gonna be here. Hopefully it's gonna be gone, but just like the influenza, it's gonna be circulating. So, there may come a time we may need boosters every year, but now for this particular pandemic, when you're out in the crowd, when you're out, with people, protect yourself. Just wear a mask. I mean, well, you decided the vaccination, in spite of all the information, it's not for you. Protect. And if you still need any information, reach out. Reach out. If you have any doubts, reach out. Make sure,
Great.
We are all here for you.
Great. Thank you. Thank you so much. That will end this live stream here. Appreciate everyone who posted some questions and commented and were a part of this today. Thank you so much for watching, everybody, and thank you for joining again.
Thank you.
Thanks.